I think that both men and women, when they're ready, I think evolutionarily, we weren't really designed to live as long as we are. I don't, I think like like back up 200 years, people were average lifespan was probably like half of what it is now. We were all just dying of bacterial infections in our 30s, let's say. So now that we're living longer, we need to, our biology doesn't match our life expectancy. And so we should use every tool in our box to, you know, not only like live longer, but like what we say, like add life to your years, meaning we just want to feel as best as we can for as long as we can.
All right, guys, welcome to another episode of The Report. Today, I got a repeat guest. I got someone who's doing big things in the health and wellness space, helping people look younger, feel younger, and perform at more optimal levels. He is the founder of SDBotox. I got my man, Dr. Alex Roher. Alex, welcome back to the show, my man.
Yeah, no, thank you for having me.
Looking good, dude.
Well, thank you.
Yeah, I think you might look a couple years younger than when you came on last year. What's the secret?
I mean, I obviously always do. I drink my own Kool-Aid. I definitely get Botox and filler, and I do all that kind of stuff. Laser's huge.
I
But
just turned 40.
oh wow, you look great.
Thank you.
Yeah, yeah.
Thank you. I just turned 40 a week and a half
Are you
ago.
wearing sunscreen on that boat?
Wearing some sunscreen on the boat. I got into the Botox game when we first spoke about a year. That's about almost a year and a half ago now. And dude, it's been a game changer. It's been a game changer. That's definitely helped. I've never done filler or anything like that, but just Botox and a lot of it's the mindset. Like I believe when you're building something cool and you limit alcohol and you work out, work on your fitness. But I really think a lot of it is the mindset for me. Keeps me younger. At 33, I thought I peaked, but at 40, I know it's just the beginning.
That's awesome.
Yeah.
And you're not on any hormone replacement, no
No,
testosterone
I got
yet?
tested since I saw you last,
Okay.
and I was like a 670, 680
That's respectable. Yeah.
natural,
Yeah,
and so I was like, you know what? I feel good. I have high energy. It wasn't low enough to where I would be like, okay, let's get on it, and then my body stops producing it, right? And
it
so I'm like,
does.
okay, I'm
Yeah.
almost 700 natural.
Yeah, I
What would it
know.
be if I like
Well,
actually?
it's good that you did that. So you have a baseline. So like let's say in your mid 40s, you start declining, and then you know where you want to be. You have a target to put yourself back feeling like this. It's a wide range. So it's like I think the range is from 300 to 1200. So I mean, obviously like most guys are going to feel better at closer to 1200 than 300.
Mhm.
But
I only have one buddy that's naturally like almost 1,000. He's like nine something natural.
oh wow.
But dude, I feel good. Like I have high energy. I'm always like freaking jacked and like just excited to get out of bed every morning, man, and like good sex drive. So I feel good. So for me, I decided, you know what? That will be something for me maybe in my 50s. You know what I mean? So um anyways, dude, I want to talk a little bit about Botox. Let's start there, but there's so much to cover here. We're going to talk about all sorts of stuff, health and wellness. We're going to talk about menopause. We're going to be talking about testosterone, peptides, all that good stuff, liquid nose jobs. But first off, the Botox game, man. For me, I didn't really know what it was. I think a lot of guys get into, or a lot of girls and guys are not educated on what Botox is. I always thought it was just for old people that are already have wrinkles on their face, and I really thought it was fillers, right? But what I realized is it's preventative. It prevents your muscles from, really making these facial expressions. Break down what exactly does Botox do?
Yeah, so Botox, it's a drug purified from a bacteria,
Okay.
injected locally into certain parts of the face, and it decreases the function of that muscle. So people age very predictably, and so if you look at an older person, let's say 60 years old, chances are they're going to have horizontal lines on their forehead, a vertical line or two vertical lines, the 11s between the eyebrows, and crow's feet. Those are the big three with Botox, the upper face.
And sometimes the crows I see like on men, they come like way down the cheek.
Yeah, and those are harder to treat, to be honest. That's kind of like the old rule is that the eyes are the midline of the face horizontally. Anything above tends to be Botox, anything below tends to be filler. Tons of exceptions in that. We do temple filler. There's a lot of Botox. We get like, gummy smile or lip flip or dimpling of the chin, or we do a lot of Botox in the masseter, like this muscle when you clench. And that's both slims the face as well as therapeutically, it's good for TMJ, headache, bruxism, which is nighttime teeth grinding, daytime teeth clenching, etc. But Yeah, no, Botox, it's a drug that prevents the release of a neurotransmitter called acetylcholine, which is at the neuromuscular junction where the nerve innervates the muscle. And by decreasing the release of that acetylcholine, you block the nerve from telling the muscle to contract for about 3.5, 4 months.
Yeah, and when I see photos of myself before, I didn't have a ton of lines, but you know, the lines and the facial impressions were starting to kind of happen as I got a little bit older, and
They were creeping.
yeah, they're creeping a little bit, right? And now I see photos from before and after, and I'm like, oh my gosh, night and day. The other big thing I notice is, you know, when you smile and you don't have the Botox, it kind of tends to, for most people, it tends to kind of pull your eye down a little bit,
Yep. So
and
smiling narrows the eye for
it
sure.
narrows the eye. And now when I smile, my eyes don't get narrowed, and
Yeah.
so when you're smiling, you definitely see the effects of it.
Yeah. If you think about the eye, the main muscle of the eye is called the orbicularis oculi. It's a circle muscle that goes all the way around. We really just treat the outside. But when you smile, you narrow, and when you have Botox, it doesn't narrow as much, as well as, particularly in women, we can make it so if you put Botox in that muscle in the upper outer quadrant right here, it'll actually raise the eyebrow a little bit. And I mean, like, I've probably seen 10,000 Botox patients in my life, and I would say 90% of them, 80, let's say 80% of them are women. And I don't think I've come across maybe a handful of women that don't want a little lift in the tail of her eyebrow. So it's not just reducing the wrinkle, it's changing, like you said, the eye doesn't narrow, it opens the eye, it accentuates the arch. Men typically aren't looking for an arch, but
Mhm.
women definitely.
So who would you say is a ideal patient? Like who is Botox for?
Really, it's like you're the dream patient. Like, and you're 40, I like our demographic is like, I'd say mid 20s to like 55. So you're right in the middle there. And it's like anyone that's has a line on their face when they're not making that facial expression. So everyone, if you raise your eyebrows, you get these horizontal lines. But at rest, if you still have that line, it's time to start getting Botox. What's called a static line, meaning it's there even when not being
Mhm.
expressed.
Mhm. Yeah, I'm actually once I got it and I started getting educated on it, I was like, "Man, this is game changer." You know, just you feel younger, you look younger. And I'm a big believer if you feel good, you have more confidence, you're going to perform better, right? You're
Oh,
going to make
for
more money,
sure.
all that stuff. It affects everything. And so I'm shocked now by like how many people that are actually on camera all the time that are actually not on Botox.
Right.
You
I
know, you see a
know.
lot of the facial expressions and all that. I'm like, damn,
I know. Well, that's like a side effect of Botox is once you get it, you understand it, and
you know
then
who's on
you
it
go
and who's
around
not.
and you're judging everyone
Yeah.
that doesn't have it.
And then sometimes I'll see like older women now, and I'll see like zero movement, and I'm like, okay, like
Yeah, yeah,
you,
yeah.
you you're diced up right now.
And that's the goal isn't zero movement everywhere, to be honest. You still want to be able to
You
raise
don't
your
want to be frozen.
eyebrows. Yeah, you still want some animation when you smile, but you in this area, the corrugator between the eyebrows, the goal is zero movement. Like no one in the history of Botox has ever complained about being too frozen right here. Like I can't even make that face and
Is
I don't
there
miss it.
is there a big risk to Botox?
No.
What's the downside?
Um the downside is, it's expensive. You have to get it every 3, 4 months. You'll miss it when you don't have it. There's nothing truly scary with Botox. There are scary things with fillers that we could talk about, but with Botox, the worst side effect is if you're injecting an area and the Botox gets into a muscle right here called the levator palpebrae. It holds up the eyelid.
Mm,
Then you're paralyzing the elevator of the eyelid, so you get ptosis or drooping of the eyelid.
it's
And
called
so,
droopy eye.
yeah, I mean, if
Ew.
you ever seen anyone like that, it's probably Botox gone awry. But I mean, it's something that I think happens to a lot of new providers. But once you've been doing it for as long as we have you rarely see it
Yeah,
anymore.
I got a question though, because I know there's a wild range of what Botox can cost. I know I pay about $14 per unit. But I know some girls that do like they Botox parties and they got someone coming over with like Mexican Botox. It's going to be like $6 or $7. What is the risk of that Botox and how is it so much cheaper?
Yeah, so Allergan is the company that makes Botox, and they're the only ones that can make Botox. And it's a good idea if you're getting Botox to look at the vial. Like there's a hologram, there's a lot number, etc. Because there's some sketchy stuff out there. More than likely, if it's coming from Mexico, it's probably real Botox. It's just, like different countries have different prices. Just like we pay way too much for pharmaceuticals of all kinds in this country, and we subsidize the world in that respect. Same thing. I mean, Botox, Allergan couldn't charge our prices in Mexico because it'd be cost prohibitive. No one would be getting it. And so I've traveled to Colombia, I've traveled to Turkey. And when I travel, it's, it's like part of my thing. I like go to a local med spa, I check it out, get some ideas. And I'm just like shocked by once you tell them the provider, like, oh, I have a practice in the United States, blah, blah, blah. And then we start exchanging like numbers. It's just like, I'm shocked by how little they pay for the product itself, the Botox. That being said, there are definitely sketchy counterfeit Botox out there. And like, I think there are a few hospitalizations on the East Coast recently from it was way too much Botox. And so it was getting everywhere. People couldn't swallow.
Damn.
Yeah, it got
That's scary, bro.
Yeah, 3 or 4 months of not being able to swallow is, I'd be upset.
So read the reviews before you go to a new clinic or office.
Yeah, I mean, like one thing nice about us is that we're called SDBotox, and
Yeah.
like we're at one
You
of
guys are all
Allergan's
over.
bigger.
You guys are the #1 in San Diego.
Yeah, we're I think right now we're #1 in San Diego.
Yeah. I see you guys all over. But yeah, it's interesting. Like I think limiting belief for me, I thought it was only for old people in their 60s, 70s. But you just said it.
No.
You said like when someone's in their 30s, that's about the time. Early 40s, that's when you should start getting on it because then it's preventative.
For sure, I think the people in their 60s and 70s wish
It's
it
too
was
late.
around.
It's too late.
It is a little bit too late, Yeah.
Because it's not going to reverse it. It's more preventative,
It
right?
could decrease the appearance of the wrinkle, but it's it may be fully gone, but probably they're always going to have some. So really starting early and being consistent
is the
you're
move.
just never going to get.
Yeah. That's so good. Okay, so break down the fillers. You said fillers. There's a lot more things to be careful of with the filler game. I've never got fillers. I know a lot of girls that probably do.
Right. Yeah.
There's lip filler. Where else do people get fillers?
So filler filler is hyaluronic acid. You're just adding volume to the face. Everyone does think when they think filler, they immediately think of the
lips.
the girl that's probably should have stopped 5 syringes ago. but yeah, for every one of those, there's like probably 30 women out there that are looking great, and you would have no idea because it's done well and it's done subtle. So filler areas, just starting from the top working down. I love putting filler in temples. Everyone's on Ozempic now, which is great. But when you're thin, you lose the fat in your face as well. So that's what filler is trying to replace, is that loss of fat. So sunken concave temples is a great area for filler. Cheeks, when done in moderation, is another great one. You can do nasolabial folds, smile lines, marionette lines. You could build out jaws. You could build out chins. And then, there's other little areas here and there. That's probably the most. But an area that I love putting filler in, my absolute favorite, is in the nose.
So why is that? In the nose?
So there's a couple of complaints people have about nose. One is a prominent dorsal hump. So there's a bump right here. Another one is like a downward turn tip. Especially when they smile, and so we could use filler. This is called the dorsal hump. This is called the radix, this little depression. We could put filler in the radix to make that straight. And then we could do filler in the tip and raise the tip, especially when smiling, to a little like a millimeter or two higher. We could also give them what's called the super tip break, which is super common. That's like that pixie tip where it's kind of like more of that appearance. You see a lot of post-surgical patients that have had true rhinoplasty and they took too much. So what surgery by definition typically is subtraction. You see the surgery where they take a little hammer and chisel, tink tink, and break the dorsal hump. And what we do by definition is adding volume. So instead of decreasing the appearance of the dorsal hump, we build out the radix, and it's kind of the same effect. Obviously, that's limited. If someone has a huge dorsal hump and a shallow radix, you don't want to have like that kind of nose that starts there. And if someone has a wide nose, there's certain patients that come in and you're a better surgical candidate. I would be doing them a disservice. So it's like a lot of medicine. It's moving away from invasive surgery to minimally invasive, like, more with the syringe, etc.
And this is what you call a liquid nose job?
That's a liquid nose job.
Liquid nose job. Okay, got it. So when people go and get the procedures, the nose jobs, and they get 2 black eyes, what is happening there?
Okay, so that doesn't happen with liquid nose jobs, which is one nice thing. But yeah, what they're doing, since there's a lot of trauma to the area, they're breaking the bone, which is a highly vascular. The face is so vascular everywhere, but particularly certain areas. And so they cause a lot of bleeding, and the blood just naturally pools kind of in their tear trough. And so, yeah, they look like raccoons. They have 2 black eyes for about maybe 3 to 4 weeks. There's also swelling in the bridge that lasts about 6 months. So you don't, and then there's always that like big reveal moment, which is like when it's good, it's great. But like when they take that little splint off and I mean, I've seen some awesome reaction videos where it's like,
Oh,
oh, let me swoop in there and
they didn't love it.
save the situation. Yeah.
Damn, that's
Yeah. Yeah.
crazy. And so back to the fillers real quick. Like, where's the common place a lot of women get the fillers?
I think lips are probably the entry point for most, especially younger patients. And again, done subtle is awesome, but overdone, we all know someone like that.
Yeah, personally, as a guy, I'm like, I think as long as it still kind of looks natural, good.
Yeah.
But when it starts looking like a clown lips, I'm like,
Oh
dude,
my
that's a
God.
little bit too much.
Yeah, and we say no. Literally, like someone's, and I know they're gonna go somewhere else, and they're gonna say yes, but I just don't. That's like my
Yeah.
billboard. I'm not
Mm,
trying to like make a bunch of funny looking people, and then they're like, "Oh, where'd you get that done?"
yeah,
SD
yeah.
Botox. Like, I'm never going there.
So you just say, hey, we're not doing that for you.
Yeah,
Yeah,
I explain to them they gotta practice some self love, and their lips are perfect, and like stop. In fact, there's probably too much.
totally. But yeah, I don't know, man. For me, I'm like, I've always when I limit alcohol, I go through like 60 days, 90 days, 100 days no drinking. The first thing I notice, my face will lean out. And then when I go back to drinking, even if just for like a couple days, I notice my face gets puffy, right? The inflammation that comes with alcohol. So for me, I would want the opposite effect. I'm like, I don't want the big puffy face.
Right. Wait, it has to be well placed in the right patient. When I look at you, I don't think I want to put filler anywhere, to be honest. Like,
Okay.
I mean, that's what I do. I go
Yeah.
around looking at faces all day, and
Yeah.
so
It depends on the person, is what you're saying.
it depends exactly. It's not like a cookie cutter approach of just like let's just do the same thing to everyone that walks through the door. It's kind of like a pan facial assessment. What what are their goals, and what do I think they need, and let's come together and make a plan and like, dial them in.
Yeah. Is there anything that can go wrong with the filler game?
Yes. So
What's the
filler.
craziest thing you've seen happen?
Oh, and I've seen some things. So filler is a thick viscous substance like a gel, and as such, you never want to inject it in an artery. Arteries carry blood away from the heart and
Mm,
perfuse the face and everything in the body. And so if you have an intravascular occlusion, meaning you inject a lot of filler into an artery, you'll block that artery and then you don't get blood flow to certain areas. So that's why liquid nose jobs, we have 19 providers at SD Botox. I'm the only one that does it. Like I use ultrasound. I am not comfortable with like all my staff doing it. It's just like, it's a risky area. I've probably done 602 times. I've had the misfortune of getting into an artery, and then the tip of the nose isn't getting blood flow, starts to necrose. And so you have to recognize that quickly, and you have to inject something called hyaluronidase, which is an enzyme that breaks down hyaluronic acid filler into that area and get reperfuse or get the blood flow going
mm.
again.
Is it true when girls go to re-up their lips, they gotta take the filler out before they put it back in?
Sometimes, yeah, that's a big trend right now because it's like I think people follow trends. I think that their like Kylie Jenner era of like giant lips kind of came to an end. She took all her filler out, so like everyone does what the Kardashians do, and so now we are doing a lot of filler removal. Sometimes with the goal of let's take it all out and then start fresh and start putting it back in tastefully.
Mm. Okay, so I want to switch gears here a little bit, talk about the peptide game, testosterone game. We mentioned at the top of the show, I got tested, and naturally I was, almost 700, so I decided, not to move forward with it at this time. But I know in my 50s, maybe in my 60s, I will probably get on that game at some point. Why do you think it is that up until recent years, the last 3, 4, 5 years, I feel like testosterone was looked down upon, but now it's like you realize a lot of men suffer with low T, low energy, low confidence, low sex drive, all that stuff.
Right, and they were just suffering in silence when there was such a simple solution for sure. So the number is important, but also the symptomatology. So, like you said at the top of the show, you're not really having any of the like decreased energy, no gains at the gym, decreased sex drive, crappy sleep, all those kind of things. Um, and so I think it's being destigmatized, which is amazing. I think that both men and women, when they're ready, I think evolutionarily, we weren't really designed to live as long as we are. I don't, I think like like back up 200 years, people were average lifespan was probably like half of what it is now. We were all just dying of bacterial infections in our 30s, let's say. So yeah, so now that we're living longer, we need to our biology doesn't match our life expectancy, and so we should use every tool in our box to, you know, not only like live longer, but like what we say, like add life to your years, meaning like make your years better years, basically. It's not just, you know, I want to make it to 90 or something. It's like,
Yeah.
I want to be able to ski in my 80s. You know, I want to be able to pick up grandchildren, whatever it is. It's like we just want to feel as best as we can for as long as we can. Ultimately, like with where medicine is now at, we like our life expectancy is like 75 for men, 80 for women, but it's been increasing and it will continue to increase.
Yeah.
And
One of my girlfriends, or a friend that's a lady, she's telling me that one of her exes, basically like low T, guy had zero sex drive, would maybe want to have sex like once a month, and then when they did, it was terrible. Always lazy, never wanted to go out and do stuff, and he had very low T, but he didn't want to get it treated. And so I'm thinking, like, man, like that just sounds like a boring way to live life. Like no energy, no ambition, not wanting to go and do anything, just want to sit at home and chill, no sex drive. I'm like, dude, I wouldn't want that. So I know if I was, I got to be honest, when I got tested, I didn't know where I would be. I knew I had good energy and all that, but when I tested naturally, like a little bit higher, I was like, it gave me a little boost. It gave me a little confidence. I was
yeah,
like, all right, I got this,
well,
right?
that's awesome. There's a
Um,
lot of guys that want what you have, you know.
yeah, yeah. But on the flip side, had I tested lower, I think psychologically, it probably would have brought me down a little bit, and then I
Oh,
probably would have had to get on it.
absolutely. Like I did a
What do they call
full
that?
body MRI and it was clean, no cancer,
Mm,
aneurysm or anything crazy, but it said that I had like a L5S1, kind of like my lower back, the two vertebrae weren't very aligned.
sure.
I swear I started having like back pain like that day. So
Damn.
it's like, yeah, so there's like,
Placebo effect.
yeah.
Hey guys, if you're looking to get into real estate investing, but you're like, hey, I don't have the time, but you want to participate in the passive income, the tax benefits, and the wealth building, my company, Summers Capital, partners with limited partners, people like yourself, and we go out and buy boutique hotels. We have a fund where we currently own 5 hotels, and we currently have a wait list for investors to participate with us. If you want to learn more to see if this is a fit for you, you can go to summerscapital.com/invest to inquire and get on our wait list and be notified next time we have an opportunity. Again, summerscapital.com/invest. Now back to the show.
Interesting stuff, dude. So, what exactly is peptides? Is that something that you inject, or is that oral?
There's like 1 or 2 peptides that you could take orally. There's like 7,000-8,000 peptides total. There's probably 10 that are commonly used. I can get into that if you want, but
Yeah.
so it's a string of amino acids. So amino acids are the building blocks for proteins. So like all the enzymes and how our body works is all protein. And those are very long strings of amino acids that, you know, fold a certain way and do all these crazy things on the body. Peptides are shorter strings of amino acids, between 2 and 50 amino acids in length, and they are the body's way of communicating. So it's like kind of like a hormone, like testosterone, for example, is made in one part of the organ of the body, the testes, and it affects the muscle. So it's kind of the same principle. It's like some are made, let's say, in the pineal gland in the brain, and they affect like how you sleep or like how tan you are, or there's it's just these little peptides, these little strings of amino acids are away from one cell in one part of the body to talk to a cell in another part of the
Mm,
body.
that's it.
That's
That's all.
it.
That's
That's
all
it.
it is.
Yeah. And the problem you were asking about taking it orally. The problem with taking it orally is that it's like when you eat a steak. That's a lot of protein. That's a lot of amino acids. But your
You're not
gastric
metabolizing.
pH, yeah. Well, once it hits the stomach, it's gonna be, and between the gastric pH, like the acidity of the stomach plus the enzymes, it's gonna be broken down into individual amino acids in the GI tract, and then you're gonna absorb them one at a time. So you never get like like the string of 10 amino acids that are like that makes up a peptide for cellular communication. So as a result, you have to inject
hmm
peptides.
hmm What's the difference between like peptides and TRT? Because TRT is a more common one, right?
Yes. So TRT is the testosterone molecule is actually based on cholesterol. It's a modified version of cholesterol, and that's how testosterone, estrogen, all those hormones work. Um, and that's how the body does that. But really, peptides are really more granular. It's like my undergrad degree is in molecular biology. So what happens is in the nucleus of the cell, you have DNA that then gets transcribed into messenger RNA that gets translated into protein. So that same that's basically like the most fundamental way a cell works. And so yeah, it's just peptides are just a play on that. Instead of making the enzyme, whatever the protein that does some function in the body, it's making a smaller version that's a chemical messenger within the body.
Okay. Very, very interesting. Have you heard of the pellets?
Yep.
Is that because if you're injecting, and I've never done it, but my buddies that inject are like, yeah, we'll typically do a couple times a week. Now the pellets, that's something where you can get away with injecting how often?
So we don't do pellets, but a lot of people do. And it's like a pellet, and you insert it into the upper buttocks right here. You take a little stab with a little 11 blade scalpel, and then you have this trocar, this thing that introduces the pellets, and they're good for 3 months.
Damn, that's
So
a long time.
so if someone's truly needle phobic and just does not want to inject once or twice a week, pellets are an option. The problem is if you get it wrong, it's like, now I have too much, now I have too little, now, so I like
You can monitor it better.
injectables for testosterone just because you can
Yeah.
modify it. Yeah,
Yeah.
like I had my testosterone was like, I think it was in the high 300s. So I started testosterone, but I was kind of like a super responder for, like I was on 160 milligrams a week, which is pretty average normal dose. And my testosterone was like 1500, which is, it felt pretty good, but it's not ideal. Like bodybuilders, like they abuse it to like 10,000, and like then they have all kinds of new problems. You could actually have like sexual dysfunction from having testosterone that high.
What were the side effects at 1500?
Just mostly felt amazing, to be honest, but it wasn't a good idea.
Even mentally, you feel
Oh
that
yeah,
much
like
better?
brain fog,
Goes away.
mental clarity. Yeah. I never really had a ton, but a lot of guys report the kind of the brain side of it all. I think it's very discouraging when you're working hard at the gym and you're not seeing gains. It's like going to make people not go to the gym. And I think like of everything, like that's probably the most important is like physical exercise. So it's like, so I think I love that. Just like we were talking about earlier, kind of somnolent, lack of energy, decreased sex drive, could even lead to erectile dysfunction if too low. So, you want to be, there's a healthy place to be, and everyone's a little different. Like someone could have a testosterone of 400 and feel amazing, and someone could have a testosterone of 400 and feel terrible. So it's not just the number;
It's
it's
how you
also
feel.
the symptomatology.
Yeah,
Exactly. So
I
it's like
I
you
like
treat the
that.
patient, not the number.
Yeah. I like that. It's almost like if you're into fitness, it's not so much how much you weigh on the scale. It's like how does your body look? What does your physique look like in the mirror?
Oh
That's
yeah,
almost more important,
I
right?
agree. Like I think weight is like a very rudimentary scale way of looking at health because muscle weighs more than fat. So at our office we have a DEXA scan. So it's it's an X-ray type technology, and it tells you scans your entire body. You just lay there, it goes down you, and it tells you your body fat percent, the most accurate of any method. Tells you your lean body mass, muscle. It tells you your visceral fat, so meaning the intra-abdominal fat, the fat within the abdomen. That's the dangerous stuff that's associated with metabolic disease, heart disease, etc. It tells you women primarily their bone density, especially if they're not on hormone replacement and they're postmenopausal and they're white, small women, especially from Northern Europe, like they will get osteoporosis, and then they will just, oftentimes when an old person breaks a hip, it's not because they fell and broke their hip, it's because their hip broke and then they fell. So bones just become so weak. Men, not as common, and darker skin, not as common, but I love getting all the data, and it gives you that data point, and then you do an intervention, you start working out, you start taking peptides, testosterone, whatever it is, and then you could get another snapshot 3, 6, 9 months later, and you see the results, and that's really far more important than the number on
Than
the
the number on
scale.
the scale. Yeah, I like that. I wanna. How do I get in there and use your DEXA scan? I want to start doing that because I didn't know you had one, and the only one that I knew of was like pretty far away.
Yeah,
And when you go to book, it was like 30 days out. I'm like, dude, this is a pain in the ass, man. So
yeah, they're popular.
because for me, I would probably like to do it every 2 weeks, just because I'm active, I'm down my fitness, and I want to see where I'm at every couple weeks.
Yeah, so within San Diego, there's 7 SDBotoxes, and then there's 1 Hormones and Wellness by SDBotox. It's on the 5 freeway in Washington.
Good location. That's
Good, yeah,
central,
super
close to
central.
where I'm at,
Yeah,
close to where this podcast set is at. And that's the location where you have the DEXA scan.
that's where the DEXA is. We
Okay.
also do VO2 max.
What's that?
That's so. Have you seen those guys that test they do where they put the mask on you and make you run on a treadmill or a stationary
Yeah.
bike, and they increase the speed and the incline, and it's really a measure of your cardiac output. It's meaning like how much blood your heart can pump. Um, and so it's good. Obviously, endurance athletes are, like very high, but that is like one of the number one best indicators of overall health and longevity, like how you're at your cardiac fitness level. And so that's another awesome one that you do, maybe like, again, like in your case, you want to do it every 2 weeks, you certainly can, but like let's say like 3, 6, 9 months, so that you can see if what your exercise routine or whatever you're doing is working. Grip strength is another really important one as people age. Again, going back to an old person that falls, oftentimes we all trip. But what happens is an old person falls and they try to grab something to catch themselves, and their forearm and their forearm strength is just so weak that they just keep falling, and then they end up fracturing something. So grip strength, doing farmer's carries, or even just hanging from a bar, like those are awesome exercises that really will help. Is another indicator of overall health and likelihood of living long and living
Yeah,
well.
it's crazy to see. I've seen like articles, and I've heard other doctors on this show talk about how there's a direct correlation with longevity, how many years you're going to live, and like your muscle mass.
For sure. So muscle isn't just, like strength and like function. It's also the biggest user of glucose in the body. So the more muscle you have, the less likely you are to develop metabolic disease, meaning diabetes and all the sequelae that come after that. And so, yeah, I mean, I will admit that SDBotox is primarily aesthetic, and so it's more for like people that are, want to look their best, and hormones and wellness is more health. But I actually don't really care why someone comes in, because the end result is, we get you. If you wanted to lose weight for the aesthetic, that's great. You're also going to get the health side. If you're doing it for the health, you're also going to get the aesthetic and confidence side. So I really don't care what the entry point is, because the end result is you're going to look better, feel better, and you're going to be healthier. You're going to tax the medical system less. So, which is all broken, but yeah, don't make me go off on that. But like, but yeah, vanity, like healthy. A healthy person is a beautiful person. A lack of disease, like, is healthy. And a beautiful person tends to be healthy. Like, like I just don't, like that's what we perceive as beauty, is the lack of disease in someone, like the beauty, this like,
Yeah. Break down the benefits of cold plunge and cryo.
okay. So yeah, so in that same
I gotta be honest,
office.
I've never done either.
Okay.
Everyone keeps telling me, hey, you got to do the cold plunge, you got to try the cryo. I'm like, okay, like I'm down to try it, but for whatever reason, I haven't done it.
Yeah. Well, the old joke, like, what's the first rule of cold plunge? Like, tell everybody about cold plunge. Like, my whole Instagram feed for a second was just like people cold plunging.
Yeah.
There's a mental side to it, which is awesome. Like getting out of your nice warm bed and going into like a 40-degree tub of water.
And are you supposed to do it first thing in the morning?
A lot of people do. Yeah, it's
Yeah.
called bed to bucket.
Okay.
Yeah, that's what I do. I have it right outside my master bedroom.
Yeah.
It's like a discipline component, but it's also just so good. It's like a big peripheral vasoconstriction. So all the vessels in the arms and legs constrict, and the blood gets shunted to the major organs. It's great for just decreasing inflammation. You always see like, all the athletes sitting in their ice baths. There's so many benefits to it that go like I think it's called hormesis, and it's what basically is like a little bit of stress in any way is a good thing. Too much, if you stay in the cold plunge for like 20 minutes, that's a problem. Now you're losing a toe or something. But a little bit of stress in any way actually makes the body stronger. That's cold exposure, heat exposure. That's intermittent fasting, being hungry. Like that's like anything that you do in any stress in a moderation tends to make the body stronger.
Okay. And so you go bed to cold plunge and first thing in the morning. Give me like the top 2 or 3 benefits that you're going to feel.
It sucks when you're in there, but you feel great afterwards. It's an endorphin release. Energy level skyrockets. You know, I do drink my coffee and my cold plunge too. It's part of my morning routine. Um, and then the mental aspect we talked about, just that if I could do that, then, you know, it's a disciplined thing to do. So it's like I could do a lot of things. I think, you know, it's hard to make medical claims because it hasn't fully been studied. I can't say like, you know, helps with
Yeah.
prevention of heart disease or something like that. But it really, I feel it does, but I can't really make that claim.
Yeah, absolutely. And then break down the cryo, because cryo is non-liquid, right? You're not getting wet.
Exactly. So cryo is a chamber that you get in, and it's negative 150, 160 degrees.
Ooh.
Yeah.
Yeah.
That's like so I would say it's less painful, shockingly. Water is probably the most miserable. It's not pleasant in there, certainly. But it's it's just a different mechanism, and water, like liquid, transmits heat 19 times more than air. But there are other benefits, like it actually shunts the blood more in from the extremities to the organs in the cryo. So we do both, you know, like 3 minutes in either. And I mean, you should do it. You should, when you get your DEXA, come do some cryo and cold plunge.
Maybe I will. I'm definitely coming in there for the DEXA, and I'm down to try the cold plunge. I'm gonna do it. Yeah, I'm gonna make it happen. I got to try it at least once and see what the hype's all about, man.
Yeah, it's cool because it's in the same room as the sauna. So it's
Okay.
called contrast therapy.
So you say do both.
Do both. Yeah, sit in the sauna, get super hot, go in the cold plunge, get super cold, go in the sauna, get super hot. It's
Okay.
great to go back and forth like that.
Okay. And how many sets of that do you recommend?
It's a 45-minute session.
Damn.
Yeah. I would say like you're in the sauna like 90% of the time, at the cold plunge
And
like
that's
10.
good for your body. You're going hot, cold, hot, cold.
That's great for it. It's
Really?
like, yeah, it's like working out your arteries. It's like vasodilation, vasoconstriction, vasodilation, vasoconstriction.
Yeah. Interesting. Okay. I'm gonna come in there. We'll try it out, man. And then break down red light therapy. What does that mean?
So red light therapy, it's a photomodulation. So it's great for your mitochondria. It's like, you know, it just supercharges it. It's actually just, again, there's a mental aspect to it. You can't have your phone in there. You're just meditating. We actually have headphones and like a Calm app that people love in there. It's kind of, the red light penetrates deeper into like an infrared sauna, for example, than a traditional Finnish sauna. And so it really gets to the deeper layers and helps anti-aging, helps muscle strain, helps stress. It's so good for the body.
Infrared or red light? Which one do you recommend? Which one's better?
Red light is the bed, infrared is the sauna.
Yeah. Okay, got it.
They're all
So
my
it's two different
children.
things.
Don't make me choose. Yeah. For me, I love a sauna cold plunge combo. That's really, I like, you just feel alive afterwards.
Okay. I want to switch gears here and talk a little bit about, we're talking about testosterone, but with the females, they go through something called menopause.
Yeah.
Break that down. What is menopause?
So menopause, the definition of menopause is the absence of a period, like a monthly period for 1 year. So by the time you define menopause, it's over. So then there's what's called perimenopause. And menopause happens around 50. Perimenopause is the start of that, and it happens in the early 40s. And this is just a group of patients or women that have just kind of been forgotten by traditional medicine. Like historically, in the 90s and early 2000s, women were on hormone replacement, so estrogen, progesterone, testosterone, DHEA, etc. Then this study came out called the Women's Health Initiative, a terribly flawed study, and basically said it increases your chance of breast and ovarian cancer or uterine cancer, and basically like you have to stop. So doctors stopped prescribing it. Women that had been on it for 20 plus years had to stop. And then they would go through menopause at like 65. My mom, that's what happened to her. She was 65 in that time, and she started getting brain fog, could not sleep. You know, she finally found a provider in that era that would put her on the hormones, and she's on it still to this day. She's 80 right now.
So the premenopause that you talked about in your early 40s as a woman, what does that mean? Like you're not getting your periods for?
No, the periods might get a little irregular, but usually the symptoms are like decreased sleep, which is so easy, progesterone, like brain fog, estrogen, and like lack of sex drive, testosterone, chronic UTIs, the pH of the vagina changes, you know, and nothing makes me happier than when I walk into the room at SDBotox and there's a 42-year-old woman, she's there for forehead wrinkles. While we're doing that, I'm chatting her up about, like these types of symptoms. And like I felt like I was polishing the brass on the Titanic. Like the forehead wrinkles are important, but let's get to the root cause. Like what's really going on. So again, I'll set her up for Hormones and Wellness by SDBotox. She'll go get her labs drawn, get the results. She comes back. We explain where she's at, what we recommend. She gets started on the stuff. Oh my God, they're like, it's night and day. Their mood is better. Their sleep is better. Like say like menopause affects 100% of the population because it's like it affects women, but
It affects
Yeah.
their partners.
yeah, their partner is gonna get it.
Yeah.
Like they see they're changing, and usually not in a good way. So it's like they're gonna get kind of the brunt of that sometimes.
Yeah. So you get the perfect solution for it. So they get the lab work, and then typically what is the treatment from there?
Yeah. So, and the treatment would be starting hormone replacement. It's a lot. Men are so simple, like testosterone. They love you. Women, there's estrogen, progesterone, testosterone, DHEA. You have to get, and you could have 3 women the same age, the same symptoms, the same labs. You put them on what you think is the right combination. One stays the same, one gets a little bit better, and one gets a lot better. So it's a lot more finesse, a lot more kind of like we were talking, lack of cookie cutter, like really like making the right regimen for that person. And so trial and error, but once you get them on the right, dial them in, they're so happy. They're back to their old selves.
So you got how many locations now total?
I have, I have 7 SDBotoxes in San Diego, 1 Hormones and Wellness in San Diego, 3 offices in Orange County, and 2 offices in Texas.
And in Orange County, Texas, you still call it SDBotox?
Yeah.
Okay.
Yeah.
I like that. And then which office are you most active at personally?
So me, I like to touch 4 offices a week, but I'm only clinical 2 days. So Monday is like my admin day. Tuesday, I start in Mission Valley and end in Little Italy. Wednesday, I start.
You have a Little Italy location?
Yeah.
Really?
Yeah.
I didn't know that.
Yeah. You can walk there right now. It's on Kettner and it's right by the Crack Shack. Yeah. We're like
that's newer. Yeah.
No one knows that because I can't put my giant sign on that building because my landlord hates me. But like, that's a great office.
Okay.
Crystal's our main provider. That's also where we do the hair transplants. So it's like a little tucked away, but once people find it, they love that place.
Yeah.
But yeah, so that's my schedule. I have clinical 2 days. I have 2 kids, so my weekends kind of belong to them. So Fridays are like my weekends.
Yeah.
I like to.
So you Monday through Thursday schedule, and then Friday, Saturday, Sunday you're off.
Yeah,
Yeah,
exactly.
like that. Okay. That's good stuff, man. And then you mentioned before we started recording, it's been a dream of yours to get into the boutique hotel game and possibly start a health and wellness boutique hotel.
Yeah, that's why
Talk
we
about
should
that.
talk. Yeah, so that's kind of the natural evolution. Is like the wellness is doing well, but I would love to have a destination. Like a boutique hotel, be it like somewhere in San Diego, but like it could be coastal, it could be mountain. Where people come and we do extensive work on them. Meaning like there could be an aesthetic component if they want, but really it's more the wellness. It's more like a full body MRI, like the DEXA scan, the cardiac CT, like we do like extent all the labs, what's called the gallery test, which is a blood test that tests for 50 different cancers. And then there'd be a 3-day water fast where you do nothing but drink like 4 pints of water a day, kind of detox the system. And then there would be like kind of like the coaching wellness components that we would have, like trainers, we would have nutritionists, we would have all the like really like a place to jumpstart a change in your life. I have many dreams. That's one of them. But
Yeah. No, that would be cool. I've always I want to get a hotel. We will buy a boutique hotel in Catalina. And I've done a lot of trips out there over the last year or so on the boat. And one thing I've recognized is there's a big gap in the marketplace. There's no gym out there, right? And with the need for fitness, good weight room, and all that, there's a big gap out there. Not just for people that travel out there and stay at the hotels, or maybe they stay on the boats, but even for the locals, right? There's a lot of people that work out there. They get a lot of tourism year round, and so I thought it'd be really cool to do a boutique hotel out there, and then implement some sort of retail location that would be a really cool gym, bring in some good social media marketing, leverage influencer stays, and really, really have a cool health and wellness component, cold plunge, sauna, all that sort of stuff. But because you would have like the only like really cool gym out there, not only would you attract other residents, or not other residents, but other guests that come and stay at the hotels around there. You can sell guest passes, but also the locals would want to work out there as well.
I love a good hotel gym, you know, and I'm sure you travel, you've seen the spectrum or like crappiest little thing you've seen, and then all dialed in techno gym. I don't know if you've ever been to Miami, but I'm sure you have.
I have,
but,
yeah.
Have you ever stayed at the One Hotel?
Not in Miami, but I've stayed at the One Hotel in Kauai. It's super nice.
Okay, I don't know that
and
one.
Their gym's super nice.
Is it?
Yeah.
I think there's some kind of collaboration between the One Hotel and a gym called Anatomy, and it is like the coolest gym. I like in my old age, I've like that's part of my travel is like I'm looking at the gym while I'm deciding what hotel to stay at.
Yeah, no, it's definitely big, and it's trending right now. And so yeah, and in addition to that, man, like I know some of the hotel owners out there in Catalina, and a lot of the product is very tired. And so, some of the tire product right now, they're driving $700 a night ADRs. And so I thought, man, if we can go in there, buy a well-located boutique hotel out there, do a really nice job with the reno, bring in some good marketing, drive some good revenue management, I think we could drive some really high ADRs and force a lot of appreciation, and then have that health and wellness component to where now, attracting guests that want to pay top dollar, but also we're attracting guests that are staying at the other hotels that still want to, come in and get a day pass.
Yeah, that'd be awesome. You should do that. I mean, that is, I'm really happy with kind of the trend in the country that younger people are prioritizing their health. I think younger people are, they're beginning to make good money. Younger people are willing to spend a higher portion of their money on health
and longevity
and wellness. Yeah. As opposed to the older generation, it's kind of like they're just kind of collecting material possessions a little bit. Like not everyone all the time, but it does seem like the younger population is more into health and wellness and more into like experiential. I think that's a great evolution of like what you spend your money on. That's,
And I think how old are you, Alex?
I'm 44.
You're 44. So I just turned 40, and I think we're at the age, where you start to really see people go in a couple different directions. We all grew up with friends from high school and, friends from college, and, late 30s, early 40s, you really start to see people go in two different directions. You really start to see that gap in terms of like how old they really look. Because some people, I mean, I talked to a lot of people on the podcast, and, the ones that take really good care of themselves. I mean, Grant Cardone, for example. Grant's almost 70.
Yeah.
And the dude looks great.
He's got the energy for sure.
Got the energy, looks great for his age. But
I don't know this for a fact, but he's probably on testosterone. But he just, I don't know. He's got, he's a freak. I don't know.
Yeah, he's definitely in the Botox game. Takes care of himself. I know he just got a fresh set of teeth. But, and then obviously he's building big things. So like mentally, he's just getting warmed up. But on the flip side, Grant's almost 70. On the flip side, there's other people that are, in their 40s, and they're like, they've already peaked.
It's true. It is funny that it is kind of like, you're right. Like people go one of two directions. They either prioritize their health or they don't. And
It's crazy. Dr. Alex Roher, man, I appreciate you coming on, brother. Where can the folks get in touch if they want to learn more? And more importantly, where can they visit one of your locations?
Yeah, so I don't have to list all the locations, but call us at 844 SDBotox or just visit SDBotox.com. And yeah, I mean, that's a good jumping spot. We could get you in the aesthetics way, or we could get you in the wellness way. We got both.
Yes, and I'm coming in the wellness spot. We're going to get ready on the, what was it called? The
DEXA?
The DEXA scan. I'm going to get in there, cold plunge, the cryotherapy. I got to get in there, see what the hype's all about. My man, he's Dr. Alex Roher. I'm Rich Summers. Listeners, thanks for tuning in. We'll see you guys the next one. Peace.